Swimming is an individual or team racing sport that requires the use of one's entire body to move through the water. The sport takes place in pools or open water. But let's go back. How old is swimming? Swimming emerged as a competitive recreational activity in the 1830s in England. In 1828, the first indoor swimming pool, St. George's Baths, was open to the public. By 1837, the National Swimming Society was holding regular swimming competitions in 6 artificial swimming pools built around London. As with any sport, swimming also comes with its own set of injuries. Swimming injuries have many different causes which can occur immediately or as a result of a long-term swimming career. Some ways that swimmers can increase the risk of an injury are by overuse of a specific part of the body or by lacking crucial flexibility and strength.
Hello, good day. We are joined here today by Mr. Seth Melendez, who is a professional swimmer and a sports coach who will be sharing to us his experiences as a swimmer, as well as talk about some injuries related to this field, which is swimming. Hi, Seth. Good afternoon.
Hey, good afternoon, Mark.
So, Seth, can you tell us more about your life as a swimmer? How long have you been swimming and all those stuff related to swimming?
Alright, so I started as a competitive swimmer since 2005. At first, I did not appreciate the life as a swimmer, but as the days goes by, as I keep on practicing every day, I appreciate, and it's a great exercise.
So how old was you then, or were you then?
I think I was 12 years old or 13.
So Seth, like any other sports, swimming also has its own share of injuries. What do you think are the most common injuries that are associated with swimming?
So in my experience as a competitive swimmer, I experienced a lot of injuries such as swimmer's ear, cramps in my legs, but there are actually common swimming injuries that I encountered, which are the the swimmer's shoulder and the swimmer's knee.
Swimmer's shoulder is a term used to describe the problem of shoulder pain in the competitive swimmer. Swimming is an unusual sport in that shoulders and upper extremities are used for locomotion, while at the same time requiring above average shoulder flexibility and range of motion for maximal efficiency. This is often associated with undesirable increase in joint laxity. Furthermore, it is performed in a fluid medium, which offers more resistance to movement than air. This combination of unnatural demands can lead to a spectrum of overuse injuries seen in swimmer's shoulder, the most common of which is rotator cuff tendinitis. Different imaging modalities can be ordered when a swimming injury is suspected. For radiographs, an APY scapular or outlet view and axillary view of the shoulder should be obtained when the pain persists after 6 or more weeks of rest and rehabilitation. These radiographs are performed to rule out other differentials of the shoulder pain. MRI is the study of choice that would be most helpful in determining the source of injury in swimmer's shoulder. An MRI images the full spectrum of rotator cuff pathology, the most likely source of pain in swimmer's shoulder. In most cases, the MRI is normal. On occasion, the MRI would demonstrate increased signal in the substance of the supraspinatus tendon, indicating tendinitis or tendinosis. If fluid is detected in the subacromial bursa, bursitis might be present. If a labral tear is suspected, an MRI arthrogram with intra-articular gadolinium is more sensitive and should be considered. Now, for swimmer's knee. Swimmer's knee is also called the breaststroker's knee because it is most commonly developed during the stroke. Symptoms include general knee pain, inflamed and/or fatigued knee tissue, swelling of the knee, and a sharp pain when placing the knee under stress. Long-term breaststroke swimmers may eventually become knock-kneed. The breaststroke kick is a high valgus load produced during sudden flexion extension, adduction and external rotation of the knee against a hydrodynamic environment resulting in stress to the medial compartment. There is a strain to the medial collateral ligament and compression on the lateral knee. During breaststroke, the leg whips out, helping to increase the speed of the body through the water. As the tension increases during this kicking phase, the force generated on the inside of the knee can cause problems to the medial collateral ligament, or MCL. Radiography can be performed to evaluate swimmer's knee. An AP, lateral, and patellofemoral view are performed to rule out fractures of the tibial plateau, patella, or distal femur. Osteochondral effects can also be observed. The Pellegrini-Steida lesion indicates an old injury and appears as a calcification at the femoral insertion of the MCL. The lateral capsule sign, or Sagone fracture, indicates an associated ACL tear. MRI is indicated when associated injuries are suspected. Associated ACL, PCL, and meniscal tears can be identified. Osteochondral fractures and bone bruises may also be identified. Injury of the MCL can be localized to the femoral, mid-substance, or tibial regions. Usage of diagnostic ultrasonography can also be useful in evaluation of MCL injuries.
You made mention earlier that you had experiences with cramps, for example, in swimming. So did you have also experience with your students having these kinds of injuries?
Yes, I experience a lot with my students. So what causes these injuries most frequently with my students is the lack of experience and the lack of proper swimming technique.
Now, to end our interview for this afternoon, Seth, can you give our viewers some tips on how to prevent these kinds of injuries?
So as a swimming instructor, I always ask my students to exercise before we proceed to our swimming lessons. And also, aside from exercise, I also ask them to eat the proper nutrition for their body. And as well as, regarding with the eating, you eat 30 minutes before you proceed to your exercise so that the food that you intake will be digested.
And that's a wrap for our interview with Mr. Seth Melendez. Thank you very much, sir, for the opportunity. And of course, let us always remember what he has said, to always prepare whenever we go to any competitions, especially in line with swimming. So that's it. Thank you very much and have a good day, everyone.